Good morning, Professor Wali. My name is Jairak. I would like to present my essay about did COVID-19 create a new kind of workplace burnout? I select this topic because I found that COVID-19 pandemic not only affect people health but also impact on working life. How does burnout develop? Burnout is a state of complete physical, mental, and emotional exhaustion caused by prolonged and unmanaged state. Stress at workplace can cause physical and mental symptoms. Let's talk about COVID-19 pandemic. COVID-19 first detected in China in December 2019, with the virus spreading rapidly to other countries across the world. This disease is caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. In 2012, about 3 million people worldwide died during COVID-19 pandemic. To prevent this virus transmission, there are several instructions such as social isolation and work from home to reduce the chance of infection. At the time of COVID-19 pandemic, people experience workplace burnout due to social isolation, high workload in healthcare system, and poor work-life balance. One factor that influenced burnout during COVID-19 is social isolation. COVID-19 is an airborne pathogen that can spread easily when infected individuals cough or sneeze. One of the main preventive actions was social isolation or quarantine. A meta-analysis indicates that workplace loneliness is associated with increased burnout, but lower job performance, job satisfaction, and colleague relationships. So we cannot assume that COVID-19 pandemic had a direct impact on burnout, but we can assume that it negatively affects mental health. So, moreover, a decrease in self-perceived health and psychological capital among people who has isolated was associated with higher burnout in employees. People isolate themselves to prevent COVID infection. When people stay alone for a long time, they feel lonely, stressed, anxiety, sadness, and unhappiness. This situation makes people burn out easily. The second factor that influences burnout is high workload. During COVID-19 pandemic, healthcare staff faced extremely high workload and extended working hours during COVID-19 to save patient lives. While the number of patients increased, the number of available healthcare workers decreased because some were infected and others left their jobs. For example, in Thailand, you can see in this picture in the right-hand side that the nurse fainted from work hard. Fewer staff have to work longer hours and much harder than usual. This condition causes high stress and physical and mental exhaustion among healthcare workers. Healthcare staff who directly care of patients, such as physicians, report high level of burnout. When staff have to face with death and working under intense pressure, lead many healthcare workers to burnout, and some even consider leaving the healthcare profession within 5 years. So, from all of this situation, healthcare employees face various issues such as high workload and staff shortage, which contribute significantly to burnout. And the last factor is poor work-life balance when working at home. Working from home was the one strategy that used to reduce the rate of COVID-19 infection. Some schools or universities also changed from in-class learning to online learning. Although working from home has several advantages, but when staying at home for a long period and working outside from normal work environment can cause stress, lack of motivation, poor work-life balance, and eventually burnout. The example is people who work as information technology or IT who work from home during COVID-19 pandemic. The prevalence of burnout syndrome among IT professionals who working from home are higher at the time of COVID-19, especially in female IT who are prone to burnt out compared with male IT workers. One reason is because many people consider home to be the place for living and relaxing, not for working. But when they have to change the work environment from office to home can create work-life imbalance. Women workers who work from home show negative impact on work-life balance, especially when they have children under 12 years old to take care. Because not only parents have to stay at home, but the children have to stay at home too. So, in conclusion, working from home during COVID-19 pandemic contribute to work-life imbalance and became a risk factor for employee burnout. In conclusion, COVID-19 pandemic influenced not only global health but also created significant impacts on workplace burnout through social isolation, high workload, especially in healthcare staff, and poor work-life balance. This new type of burnout in workplace were mediated by stress and anxiety caused by heavy work demands and exposure to loss and death. People also lack motivation when they felt lonely or emotionally exhausted from work-life imbalance, leading to increased workplace burnout. Thank you.